Imagine a world where doctors speak different languages, making it impossible to share patient information effectively. This is where medical coding steps in, acting as a universal language in the intricate world of healthcare. In the UK, medical coding is the backbone of the National Health Service, ensuring that every diagnosis, treatment and procedure is accurately recorded and tracked. These codes are crucial for a myriad of reasons. From analyzing healthcare trends and allocating resources to processing insurance claims and conducting research. In this exploration, we will delve into the fascinating world of medical coding in the UK, unraveling the secrets of the standard coding books and the procedural book. So, fasten your seatbelts as we embark on this journey into the heart of medical coding, a realm as intriguing as it is vital. At the heart of the UK's medical coding system lie the standard coding books. These comprehensive volumes are the bedrock upon which accurate medical records are built. One of the key players in this arena is the International Classification of Diseases 10th revision. This hefty tome, published by the World Health Organization, provides a detailed list of diseases, disorders, injuries, and other health conditions, each assigned a unique code. Complementing ICD-10 is the International Classification of Health Interventions, which focuses on classifying and coding healthcare interventions. Together, ICD-10 and ICHE form the foundation of medical coding in the UK. The UK also utilizes additional classification systems, such as the Office for National Statistics Classification of Interventions and Procedures. Each book typically includes an alphabetical index, a tabular list of codes, and detailed descriptions of each code, ensuring that healthcare professionals can easily find the information they need. While standard coding books provide a comprehensive overview of diseases, conditions, and interventions, the procedural book dives deeper into the intricate world of medical procedures. Think of it as a detailed playbook outlining every step involved in a specific procedure, from preparation and anesthesia to incision and closure. The procedural book serves as an indispensable guide for medical coders, who rely on it to assign the most accurate codes for billing and reporting purposes. Each procedure in the book is broken down into its constituent parts, each assigned a unique code. This granular approach ensures that every aspect of the procedure is accurately captured and reflected in the patient's medical record. The procedural book is constantly evolving to reflect advancements in medical technology and surgical techniques. New procedures are added, existing ones are modified, and coding guidelines are updated to ensure that the book remains a relevant and accurate resource for medical coders. Mastering the procedural book requires a deep understanding of medical terminology and surgical procedures. Section 4. Codes in Action. How coding books shape healthcare delivery. Medical codes come to life in healthcare settings. Imagine a patient visiting their GP with a persistent cough. The GP diagnoses bronchitis and uses the ICD-10 book to find the code. This code is entered into the patient's electronic health record, or EHR, ensuring all providers have access to standardized information. Analyzing codes helps track disease outbreaks and evaluate treatments. Section 5. Case Study. A day in the life of a medical coder. Let's step into the shoes of Sarah, a medical coder working in a bustling hospital. Sarah's day is a whirlwind of deciphering medical records, navigating coding books, and ensuring the accuracy of patient data. Her morning begins with a stack of patient files, each representing a unique medical story waiting to be translated into the language of codes. She meticulously reviews physician notes, operative reports, and lab results, her trained eye scanning for key information. For a patient admitted with pneumonia, Sarah consults the ICD-10 book to assign the appropriate code for the diagnosis. She then delves into the patient's treatment plan, using the ICHE book to code for the administered antibiotics, respiratory therapies, and other interventions. Sarah's meticulous work ensures that the hospital can accurately bill for the services provided, receive appropriate reimbursement from insurance companies, and contribute valuable data to national healthcare statistics. Her role, though often unseen, is crucial for the smooth functioning of the hospital and the overall healthcare system. Section 6. The domino effect, the far-reaching impact of accurate coding. The significance of accurate medical coding extends far beyond the confines of a coder's desk. It sets off a ripple effect impacting various facets of healthcare, from patient care and hospital revenue to public health initiatives and medical research. At the patient level, accurate coding ensures that they receive appropriate treatment, as their medical records accurately reflect their conditions and the interventions they've received. This accuracy is also crucial for insurance claims, ensuring that patients are billed correctly and reimbursements are processed smoothly. For hospitals and healthcare providers, accurate coding is essential for financial stability. Incorrect or incomplete codes can lead to claim denials, delayed reimbursements, and significant revenue loss. By analyzing coded data, researchers can identify disease patterns, track the spread of infections, and evaluate the effectiveness of public health interventions. Medical coding plays a vital role in clinical trials and research studies, enabling researchers to compare data across different populations and draw meaningful conclusions. Section 7. Conclusion: Medical coding, the unsung hero of healthcare. As we conclude our journey into the world of medical coding, it becomes evident that this seemingly obscure field is the unsung hero of the UK healthcare system. It is the invisible thread that binds together various aspects of healthcare, from patient care and hospital administration to public health and medical research. The standard coding books and the procedural book, though complex and detailed, are indispensable tools in the hands of skilled medical coders. Accurate medical coding is not merely a matter of administrative efficiency, it is the cornerstone of effective healthcare delivery, influencing patient care, hospital revenue, public health initiatives, and medical advancements. So the next time you visit a doctor or receive medical treatment, remember the silent but vital role that medical coding plays in ensuring the smooth functioning of the healthcare system and ultimately your well-being.